Robby, what is on your radar?
Well, we just reached a major milestone in a huge acknowledgement that most people have some form of protection from severe COVID-19 disease, either from vaccines or from prior infection. The Centers for Disease Control and Prevention no longer recommend social distancing as a general strategy to slow the spread of the virus. That announcement was made late last week and is an important one. Finally, even our notoriously cautious health officials are essentially admitting that the pandemic is over. New guidelines from the CDC state that masks are only warranted in schools if the level of community spread is high. When the spread is at medium level, high-risk individuals should wear masks. When the spread is at a low level, masks are not recommended at all. At all COVID-19 community levels, low, medium, and high, recommendations emphasize that staying up to date with vaccination, improving ventilation, testing people who are symptomatic and those who've been exposed, isolating infected persons, that all holds, according to the CDC. But the new guidelines remove the need for individuals who were merely exposed to COVID-19 to isolate, although who was still doing that, until they could produce a negative test. But now even the guidance says no more of that. Individuals who test positive for COVID-19, they should continue to isolate for 5 days. But if anyone was still waiting for official permission from the nation's top health officials to resume life as normal, well, here it is. By signaling that the universal masking and social distancing phase of the pandemic is now over for good, the CDC has conceded that the U.S.'s COVID-19 prevention strategy should now revolve around just protecting those who are at heightened risk, the immunocompromised, the elderly, etc. Perhaps most importantly, schools in areas of the country where community spread is low or medium, they do not need to require general mask wearing. This latest guidance from the CDC should give our students, parents, and educators the confidence they need to head back to school this year with a sense of joy and optimism. That's according to Education Secretary Miguel Cardona, who said that in a statement. Now, Washington, D.C. schools, they should take note because the level of community spread in the nation's capital, where I live, it's currently low. Now, I've been in touch with parents at some of the public charter schools in D.C., and these schools have had some of the strictest COVID policies of anywhere in the country, routinely recommending policies that are more stringent than what the CDC itself recommends. In one of these schools, which teaches kindergarten through 5th grade, they were masked outdoors until this April. They wore them during sports. Outdoor track was masked, one parent told me. Another one of these schools took masking so seriously that it recommended that students, quote, be careful when taking off their mask and wash their hands after removing it. Store the mask out of anyone's reach. Use a clean mask if someone touches yours, the one you're currently wearing. It's a mask, not an item of religious significance. These policies never made any sense to begin with. But now it's really time to end them. Of course, the parents I've talked to say the schools, these schools in question, they have no intention of changing course, even though the CDC now says we don't need to mask in schools if community spread is low. What happened to following the science and doing what the experts say is best? Throughout the pandemic, municipalities controlled by Team Blue, by Democrats, have claimed that they will default to whatever COVID policies and strategies that our enlightened leaders in the CDC, the FDA, and the Biden White House deem is best. They ridiculed people who didn't listen if it was against the science. Team Blue thought leaders like Dr. Fauci played into this view, actively purporting to personify moral virtue in the face of the pandemic. Remember when Fauci said that to disagree with him was to disagree with science itself? Watch.
It's very dangerous, Chuck, because a lot of what you're seeing as attacks on me, quite frankly, are attacks on science. Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science. Sometimes those things were inconvenient truths for people, and there was pushback against me. So if you are trying to, get at me as a public health official and a scientist, you're really attacking not only Dr. Anthony Fauci, you're attacking science. And anybody that looks at what's going on clearly sees that. You have to be asleep not to see that. That is what's going on. Science and the truth are being attacked.
Will schools that continue to force students to wear masks be attacked as anti-science, even though they now are out of step with CDC guidelines? I doubt it. Or does this only ever work one way? Democrats get a pass, their critics do not. Is that it? Of course it is. Now that's what we've become used to. Remember that the first and basically only general exception to social distancing guidelines was one granted early in the pandemic for one specific group: Black Lives Matter protesters. In the wake of George Floyd, when anti-racism protesters flooded the streets, public health officials said, that's fine. Recall that these were the same public health officials whose recommendations led to the closing of public beaches and parks. It was shameless then, shameless now. So, Batya, I celebrate the official end of social distancing. We're no longer, and of course the joke is no one is still doing this, right? I guess only the most ardent, Dr. Fauci is the science kind of believing person in, lockdown in miserable blue cities. Everyone else is basically going back to life as normal and has been for some, more than a year of some people. So it doesn't really matter. But even on paper now, if you're still, masking perpetually indoors in areas where community spread is low, you are no longer doing what the CDC recommends. And all these officials who said, you know what, we just do what the CDC tells us to do. So, take it up with them, which is an interesting kind of deflection, because then when we talked to you and I, when we interviewed Fauci, we said, what about these? Do you regret any of these policies? And he's like, oh, I didn't force them on anyone. These were just recommendations. So no one wants to be responsible for forcing them on the American people. But now, if you're just following the recommendations, they no longer recommend that. And I'm going to be interested to see which officials back down. I'm betting, and so far in D.C. in the schools I have some research, some insight into their practices, seems like they're sticking with the masks.
Yeah, it was so interesting when we got to interview Dr. Fauci. We got to ask him about 6 questions, and each of our questions was a different permutation of, do you regret this? Do you regret that? Would you have done this differently? Would you have done that differently? Which is another way of approaching a scientist and saying, from a scientific point of view, did you make any errors? Can you analyze from an objective point of view the decisions you made? And he was incapable of admitting to any errors, not a single one. And I think that is so interesting, because what we had with the pandemic was a perfect scientific experiment, right? Half the nation said we're going to do minimum, after the initial, 2 months or whatever, we're going to do minimal closing down of the economy, no masking, no distancing. We're going to, protect the vulnerable, but that's on them. And otherwise, just, try to manage this as an endemic from 3 months in, right? That was the Republican side. And then from the liberal side, we had, no, we're going to do maximum shutdowns, maximum policing, maximum enforcement, maximum mandates, all the stuff you and I think is terrible. And it was a perfect scientific experiment, right? Because you could see which one worked. And lo and behold, the red states got it right. Lo and behold, the children that were not forced to mask, that were not forced to quarantine in Florida, there was not a higher incidence of mortality due to COVID than in places like New York, where they were forced to do all of these horrible things that, just awful, awful, awful results for children. Yeah. So, in a sense, to me, the science, right, really was with Team Red, even as Team Blue continues to, cover itself in the mantle of the quote unquote science. And just the last point I'll make is the CDC continues to lead from behind, right? Removing all of these restrictions, it's doing this because the American people en masse decided a long time ago, we're not doing this anymore, just like you said in your radar, right? So what they're doing now is ratifying what the wisdom of the American people that refused the authority of this quote unquote scientific community that, as you have rightly pointed out and righteously over and over, Robby, has simply just beclowned itself. Great radar.
Thank you. And right, I think the answer to that question, you're right, that natural experiment we have, I would like to point out what happened in both cases. Basically, everyone got COVID, right? You can find, yes, if you really look at the data, you can find, some better outcomes here, some worse outcomes here. Some of them have to do with climate. Some of them have to do with density. Some have to do with various other things. Maybe you can point out here's a policy that worked a little bit better. This place had a little bit better of outcome. But this is true even outside the U.S. You can look at Europe. You can look at the only places that have had dramatically better COVID, in terms of the actual disease, are places that lock down far harder than anyone in sort of Western civilization was willing to do, even including like very blue states who you know, pursuing the COVID zero strategy, or like forcibly quarantining people, all that stuff. No one here, because we have a Constitution and Bill of Rights, was willing to do that. I think for good reason. Their better COVID outcomes have come at the cost of massive, unconscionable authoritarianism. And by the way, they're still having to do those things, maybe forever, because COVID is still going to exist. So you could compare those and say, yeah, there was a dramatic difference. But for everybody else, you know what? The disease, Roe's going to do what Roe's going to do. The disease spread. It was terrible. We wish it hadn't happened. But there was a lot of cost to these interventions, and I think it's hard to see massive differences, especially with the latter variants. They just, you know, they tear through. It's terrible. Everybody gets it. You know, including from your COVID deniers to your, you know, twice vaccinated, 4 times boosted, mask-wearing type people. Maybe small differences in outcome, but certainly not massive ones if you look at the data. So that's just where we are. Yeah.
Absolutely. Yeah. And I will just say there were a few people on Twitter who are, at higher risk for COVID, sort of slamming the CDC for daring to put them at risk. And I just want to say to people like that, do you understand what happens to an autistic child when you force them to wear a mask? A child who's trying to learn how to talk, who's trying to learn how to articulate words, the family of a disabled child, seeing them backsliding on skills that they had managed to so painstakingly acquire. And that is what happened. That's what's happening here. We have to get rid of this stuff. It's just so deplorable. And the idea that adults would be wishing to impose this on children for their own sake, for their own comfort, it really makes me angry, Robby.
Makes me angry too. All right, we'll have more Rising right after this. Stay with us.